Take 3. Edition of Cannabis in Canada with Jason Wilcox, coming to you today with sad news for those who don't know, and for those who do, a little more explanation. Health Canada has proposed, in a draft, to phase out 17,000 plus legal licenses in Canada. Similarly, Arizona in the United States is phasing out personal production for medical users. I see this as a potential fire, as something that is getting much bigger. So people are wondering, well, what's Canada got to do with me? Legalization is happening everywhere. We hear Mexico here, Rhode Island, I believe, recently either passed or done something. But I think the bigger thing that we need to look at is the Arizona phase out and the Canadian phase out. We need to think about it. 17,000 growers, taking those licenses away, then we need to buy only from big business. But if we keep the licenses, who loses the profit? Who cuts into that $7.2 billion Canadian cannabis industry? 7.6 billion, whatever it is. The question is, who's really cutting into that? And also, what is a fundamental right, to autonomy? Now, the right to autonomy is to put, in the Canadian courts has been established, is to put into your body what one chooses. If it's going to medicinally help you, or if you believe it's going to medically help you. I believe the right to autonomy also encompasses the right to grow that medicine, provided that it's not a threat to anybody else or, yourself in doing so. And this is where I don't understand taking out the personal production license. Being a draft proposal, it's due to be printed in the next few weeks in the Health Canada Gazette. Then we'll know. And there's been preparations taken, things have been made. The proposal can be found on this website that's below me. You're gonna have to write it down. I'm sorry, there's no way to YouTube link it onto my live feed, but to get to that proposal, just go to the Health Canada website, go to the proposal for new program. Health Canada doesn't even want it in Health Canada anymore. They want to have it moved out and put with tobacco in some other federal program. Again, they deny that it's a medical issue in Canada. Cannabis is still a narcotic and only allowed through the health minister via a Section 56 exemption for the program itself, and all 20,000 plus and medicinal cannabis legal users in Canada. Now, these statistics, of course, if you go to the Health Canada site and look at their site, you'll say, oh, this guy's out in left field. There's only 7,000 or 8,000. That's because that's how many there were in January. Now we're at 17,000. There's a reason for that. There was a flood of new doctors, a flood of support, and a flood of educational campaigns that led people to know about the Health Canada program. Now, even though it's been ruled unconstitutional, not only the program, its regulations, and its federal supply of cannabis, has all been ruled unconstitutional by Canadian courts, still we face a paper draft proposed project to simply phase out 17,000 licenses and go and give them, phase out 17,000 licenses in favor of big business test paper project that's never been tested in the field. It's a paper project. And with 20,000 sick and disabled Canadians who've jumped through arbitrary loops for the past decade of this program, plus, they went and they've done this. When I say arbitrary, I mean it's arbitrary. At one time you needed 2 doctors, now you still need a doctor. It's an issue with the doctors, it's ongoing. But here nor there, it comes down now to personal production. And the loss, what do you lose? You lose your genetics, your right to research genetics. Whenever you cross plant A with plant B, you make plant C. Plant C could have medicinal genetics, medicinal properties that will help me better for my conditions than any other genetics any big business or anybody else can have, because they haven't got plant A and B or plant A and plant B that I have. You see, we have to use their genetics at their cost, you know, and it's done under big business, because you know what? Big Brother gets the taxes. That's what it's all about. And by allowing personal production, it's gonna cut about 50% of that profit out. Sure, people are gonna order. I believe in patient options. You should be able to go and have somebody grow it for you if they have the place and the room and the ability, or order it from a pharmacy or big business, whatever you want to call it, however the program is modeled. And then you should also have the right fundamentally, especially if it's to put in your own body, just like when you smoke it, you should have the right to grow it, because you're putting it in your own body. It's not for resale. Okay, however, this goes all the way back to our original right for medicinal cannabis in Canada and the right to use it. We have no legal right to grow cannabis in Canada. We have a regulatory right under the medical marijuana access regulations that were ruled unconstitutional. Therefore, they're not really regulations, I guess. But anyway, we were bound by that. That's it. That's why they can phase out the license. And since 2001, they said they were going to phase it out. But they said they would phase it out when they had a reasonable supply of cannabis. I would argue that a reasonable supply is not an unconstitutional supply, nor a paper project not tested in the field. These would be simple arguments for simple-minded things. Big business, okay, good, patient option. But taking away the rights and creating a potential void, you know, if Health Canada goes from proposal to action, you know, we're prepared to react. I wanted to touch on the proposal so people understand that when I say big business, I call it Molson Cannabis. I have for years. I've talked about it. I've said that they're waiting on the sidelines for that rubber stamp, and now's their opportunity. You know, even if they legalize tomorrow, do you think they're actually going to let, if they're phasing out 17,000 people now, that they're going to let 1 million people in BC grow overnight? You know, same problems that Washington and Colorado are facing right now, we in Canada face the same thing on a federal level. You know, this is not about sick, disabled only. This is about personal production in the future if we legalize here. Or do we want to legalize and have to go buy it from the pharmacy, like Percocet or Percodan, or for, oh, you don't buy those, Tylenol, cold medicine, whatever. Is that the only way we want to be able to access it? And do we want to give up that right? Because I can tell you now, it's going to be a lot harder to reverse that right, and patients are going to be suffering a lot longer here in Canada while that right is overturned constitutionally in a court challenge. Now, a coalition, as I mentioned when I opened up here, the coalition itself currently has 16 regional reps that go from coast to coast, high-profile activists in Canada willing to assist because they see the same as I do, the seriousness of this nature, the serious nature of this proposal. And of course, the negotiations and rumors and everything else, we have to try and separate all that. My job is to try and talk to you, the medical growers and patients out there that have federal licenses in Canada, to get in touch with me, contact me, you know, join the coalition, contact a rep that you might be more comfortable working with, it doesn't matter, you know, or contact John Conroy's office and get your name and your license number on file, because you may be entitled to compensation for any losses due to the phase out should Health Canada go through. Now this is Plan B. Plan A of the coalition would be to letter campaign, capacity build on a mass level, you know, from coast to coast, you know, all groups. We need to drop our differences, because this isn't about who has a bigger club, who has the biggest friggin' this, who's doing that, you know, who grows what, who's the better grower, who cares? Are we going to all be able to continue to grow and supply? Part 2 of the proposal left out community-based dispensing. Now, community-based dispensing models have been keeping the medical community alive who don't grow for themselves. Okay, and I know I can't get into the specifics on how, you know, underground operations work, but you know, the fact that that model is not been even talked about in the new proposal, the draft proposal, is another issue, because that would even cause a further void. If they wiped out 17,000 licenses and shut down all compassion clubs, rated them, charged the people under the new laws, the mandatory minimums, I mean, it could be crisis for Canada 101. You know, I mean, you just have to look at the bigger picture. Now, we've consolidated people. We have representatives literally in every province and multiple representatives in some provinces such as Ontario, BC, and Alberta. You know, and I thank you all for coming aboard. John Conroy, my lawyer, has taken the initiative to open a trust fund in the name of the MMAR PPL DPL Coalition against Repeal Trust Fund. If you're interested in donating, please check out the link below. Okay, and you'll get all John's donated or John's information to donate. I'll also have it roll up at the end of the video if possible. I'm still learning the new software and trying to come back. It's been 9 months. This has been really my first real movie, but this is a real serious issue that pertains, once again, in my own opinion, this pertains to North America. Our Arizona friends are feeling the same pressure. Investing years into equipment, years into study, hobby, not to mention the therapeutic value for a sick person that has nothing to do all day, but if they get to study and learn how to work on their own medicine and actually breed plants and find genetics that work for them, that's a hobby that's therapeutic as having a dog. So I really, there's a lot of reasons that fundamentally 20,000 sick people should remain having that option. Now, with the legal coverage, John Conroy, once again, being the lawyer, I'll have his banner up above me and a link to his address below me, and you'll be able to call the office, fax the office, whatever, or link to me, and on my website for that I bought a domain name there for the coalition, and you can click the donate button and it'll take you to all the donation information for wire transfers. They do take MasterCard, Visa over the phone, and they can scan the receipt and email it to you, however it needs to be done. So I thought that should be put out there. Given that this campaign is only 7 days old, I mean, I filed my complaint 7 days ago, and you know, we're here now, and we've managed to build, you know, a framework, a general direction forward, and unite some really high-profile activists. And I thank all of you for coming aboard and joining us in this battle, because only unity and community and directional focus forward can we do this. No great battle was ever won by a bunch of small groups. It took great generals, great leaders, and great bodies to win. And I believe we can do this. It's our time. We've been fighting in these wars way too long, and way too many people have suffered. And now to lose the right to personal production is like a second slap in the face. Taking away a community-based dispensing model that works for the sick is another slap in the face. And if we ever legalize, the third slap in the face would be when you find out you can't grow your own plant, but yet you can make your own beer, you can make your own wine as long as it's for personal consumption and not resale. Why is cannabis any different? Canadian law is backwards, and we still have a conservative right-wing government that is going to be hard. But in coalition building, we're willing to work with all bodies of government, all levels of government, any supporters, any groups, our American friends. You know, if you're interested in this, especially with what's going on in Arizona, and if it continues to happen in other states, then we need to stop these initiatives. Because this is all about money. We cut into their profit, that sucks for big business, and who cares about the little guy? I do. But I'm just one man. This is going to take a mission. Now, our mission statement, our goals and objectives, our mandate, you know, constitution, what we, you know, general framework forward, operational rules, this has all been drafted and being edited now. I've been playing catch up for 7 days, having just transitioned from, you know, one city to another, in setting up this little temporary booth to get this message out. I just wanted to get it done and make sure that I covered as much as possible about how this is working, because a lot of people, you know, a lot of people online really want to help. They want to jump in. How can I help? What can I do? You know, and right now it's about coalition building. Let's build some bridges. You know, if we have old barks with one another, let's set them aside. Let's send an email to one another and say, let's put this behind us for the better of this particular fight. You know, if you believe in the fundamental right under Section 7 to autonomy. And if that, I don't even know if it's a Section 7 charter challenge. I'm not a lawyer. I'm just a guy consolidating the sick people, you know, and consolidating the supporters, you know, who know how that, you know, all the sick and disabled of Canada would not be supplied with medication if this phase out went through. They would simply be back relying on the black market, which is against HITSIG. Okay, the HITSIG decision saying we should never have to rely on the black market. I believe that's where they put us right back. What about the people who owe PPS and never paid them? Do they get credit with these new operations? I mean, there's so much unsaid, and the threats for 2014. So we'll see what happens when they print, you know, the new proposal, because of course drafts are drafts. They can be amended and changed rather rapidly, but starting a campaign and being prepared is important too. We have John Conroy, we have a trust fund set up, we have donations already made, pledges made, we have a coalition built of over, what are we at now, about 600 members officially, and we got 16 regional representatives to help collect the data. Due to the confidentiality clause in whenever we're collecting patient letters, patient license numbers, patient photocopies of licenses, etc. If we're collecting that kind of data, everything will be under a confidentiality clause for regional representatives. Should all the stuff that's been drafted move forward. I keep saying it's because I was with a listserv for a very long time, close to 8 years, and only one document was ever able to be produced on a national campaign for cannabis in Canada, due to all the groups and different opinions and values and, you know, objectives in the cannabis movement, be it medical, be it legal, whatever it is. This is where we need to look at dropping those issues for a fundamental issue, which is the right to grow. If such a high-profile lawyer as John Conroy thinks he can find a way, or believes that there is a way that we can win should Health Canada phase out these licenses, then we can make it a constitutional right rather than a regulation in Canada, which is our end objective. Should Health Canada fail to recognize the fundamental right for one to grow their own cannabis. This is Jason Wilcox, reporting from Vancouver, BC. I'll see you in the next show. Cheers.